I love to travel. Love to travel, love to get out the house, and anything outdoorsy. Working out, kickboxing, walking, running, biking. I usually work out 5 days a week. And having fibroids, when I would get my monthly, I would actually have to stay home on the couch watching movies for fear of the flow just being too heavy and leaking through my pants and it showing and being embarrassed. I would have very, very bad cramping. It was so bad it would wake me out of my sleep 3 or 4 times a night. I didn't really know if it was a fibroid or not. Went to my doctor after I discovered from laying in bed one day, or laying on the floor actually, and there was something poking out of my stomach and it was really hard. So I had no idea what it was. We went ahead and had an ultrasound and discovered that I had about 4 or 5 fibroids, with the largest one being, they described it as a 4 or 5 month pregnancy. So at that point, my doctor recommended that I have a myomectomy, which is where they actually go in and invasively cut the fibroids out, which is major surgery, which also leads you into a 4 to 6 weeks time off from work, which I could not take off at the time. So that really wasn't an option for me. I didn't really want surgery. I didn't want to take the time off from work. I couldn't take the time off from work. So I went on the internet and started researching, one, what a fibroid was, what the treatments were out there, and I gathered a lot of information on the internet. I heard about the Fibroid Treatment Collective on the radio when I was driving home from work one day. Went onto their website and obtained more information through webinars and information on the site. I chose embolization because it was a non-invasive procedure. The recovery time was 1 to 2 days. I could be back to work by that next Monday if I had the procedure on Thursday. So that was definitely a plus. I didn't have the risk of the myomectomy where I could have ended up in a hysterectomy. And that rang a bell for me. That was definitely what I was looking for, what I wanted. And I decided at that point it was for me. I had the embolization procedure in November of 2010. And now, even immediately, 2 months afterwards, my cycles were night and day. Very, very light. I could go to work, I could work out, exercise, I wouldn't even have to think about it. It wasn't a choice. I regained the life that I always wanted. The greatest thing about having the embolization procedure, I just feel like I got my life back. I can book my vacations, not around my regular cycle. I don't have to think about it. I can pretty much wear what I want to wear. I don't have pain anymore at night or even 2 weeks before my menstrual cycle. It's very, very little pain, if any, which is freedom. And I definitely don't have anything sticking out when I lay down anymore, which is perfect. Don't put it off. Go right away and see what you can do about them. Whether it's looking at the embolization procedure if it's for you, or any other alternate procedures. But don't put it off because they do just grow, get larger, and cause more problems.